Hello, 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 everybody. I am hopefully going live today with Dr. Edith Shiro. Putting on a little say lip. For those of you following my skin journey, you can still see it here. Yeah, it's not great, but it's also so much better that I'm thrilled. So today we are talking to Dr. Edith Shiro about her book, The Unexpected Gift of Trauma, which, I think we need this message more than ever because there doesn't seem to be any obvious gifts in trauma. Nobody wants it. Who would choose it? No thanks. Whether it be an acute one-time trauma, whether it be a secondary trauma, whether it be, right, historical trauma, right? All of these different traumas are outlined in the book. And so it's important to know that we're not hoping for trauma so that we can grow, right? But if we're going to be living as humans, which we are, then accepting trauma as part of our lives and how to work with it to bring about change is really important. Let me just check. Make sure everything is going okay. Too good of a girl. I know. So what does everybody think? Does everybody think Taylor Swift is problematic for dating Maddie Healy? What is everyone has a hot take on it. So what's your hot takes? Should it not be, she have not done it because Maddie Healy has said problematic things about,
Hello.
Yay! Hello, am I
Yes.
your name right, bro?
Can you hear me?
Perfect.
Well,
Hello, Edith Shiro.
yes. Good.
How are
Happy
you
to be with you here.
I'm so happy to have you on. For everyone joining, Dr. Edith Shiro, she's going to write over my bed with my pen in it.
You sound a little bit chopped, but
we are talking about the unexpected gift of trauma. First of all, as a person who wrote the book, struggled with the cover.
Thank you so much. That's the credit to my amazing publisher that chose those colors. But the idea of the cover has like a meaning, like a special meaning. Do you know what it is?
Yeah, I do. It's the Japanese practice mending something that has been broken and with gold or silver and actually celebrating
Absolutely.
that
It's
and making
called
it more
kintsugi.
beautiful.
Thank you so much for knowing about that. I always ask that question. And if I'm giving a conference, I ask who knows what the cover is. And if somebody raises their hand, I give a book for free because.
Great. Everybody in the audience, if you said it aloud.
Yes, so it's called kintsugi, and it's a Japanese philosophy actually, and it's a technique also of like mending broken things, but specially applied to Japanese vases that are very valuable and cost a lot. And when those vases are broken, instead of discarding them, what they do is they use a technique with like golden powder or silver, and they try to put the pieces back together in a way that is even more artistic, even more beautiful. And those vases, those jars, those pieces increase their value. And the meaning of that, which I think is so beautiful, is that when things get broken, instead of like staying broken or discarding them or losing their value, they can become something so much more and different, because it's no longer the vase that it's not. It looks different, it feels different, and it's more increased. Like if the value increases, the golden is there, it grew, it transformed, it became something else. So it's a perfect analogy and metaphor for the unexpected gift of trauma.
Yes, it is. And I want everyone to know, so, I'm a parent coach. So what I do is parents who don't know what to do with their kids call me, right? I don't see the kids. I just work with the parents because I see them as the experts, right? If I come in and coach the kids, especially in front of the parents, I feel like it
Yeah,
can not always
yeah.
diminish their power, right? So my work surrounds so many
Mm-hmm.
levels of trauma life. Um, and I find that the parents have trauma both known
Abs-
and unknown, what they have just
Absolutely.
life, right? And um, I think for a long time, as you well know, you've been in this field for 30 years, which feels
Thank you.
impossible because you look
Thank you.
30.
Thank you.
That you started, oh, but anyway, uh, what you're having. I think what's interesting is that trauma has become a big buzzword, right? And it's kind of worked its way into TikTok, and everyone is trauma and everyone's triggered. And people get annoyed, but I think that this is a good thing when words become more in the culture. It can also start to lose its meaning, right? And like my 16-year-old will be like, I'm traumatized that you keep giving me soup and salad for dinner, right? And I'm, ha ha ha, right? But for everybody out there, what is your definition? And do that people talk a lot about big T trauma, little T trauma. How
No,
do
I
you
love that
define
question. Thank
trauma
you so,
in
so
your work?
much actually for asking that question. And I've been talking about trauma for 25 years, and I know that maybe 25 years ago or 30 years ago, people would cringe with that word. And up until very recently, it's been associated with war veterans, with refugees.
Just, just
Right, with PTSD,
post-Vietnam,
post-traumatic
right?
stress disorder, right? Uh, I actually love
Right.
it that trauma has been part of our vocabulary, and in the same way that other words like, I don't know if you've heard the kids say, "Oh, you're bipolar," or you're a narcissist.
Totally.
Those are serious
Right.
diagnoses, right? And usually those words are not applied properly to people. When you say, "Oh, you're bipolar, you're a narcissist," it has nothing to do with the actual diagnosis and what it means. When I explain it to my patients or to people, they're like, "Oh, that's what it means." Then I'm not applying this. That doesn't apply. Same with trauma. But I'm happy that you're using it. I'm happy that people are using it because it needs to be part of a vocabulary. And yes, sometimes, your 16-year-old can say, "Oh, I'm so traumatized. This is the food that we had in school today." Yes, it's an expression. But how do I define trauma? Trauma is any event for which you are overwhelmed and you have no tools or resources to confront or deal with or handle, and then it destroys or breaks your belief system about yourself, about others, and about the world. Now, that can be war, that
Mhm.
can be a pandemic, right? That can be being at home for 2 years without going out. That can be traumatizing for some people, for other people, not. Moving countries, but also trauma can be a divorce, trauma can be being bullied in school, trauma can be a parent that is emotionally unavailable, a chronic situation of like an insecure attachment. Those are serious traumas that you might not seem as like, oh, it's a sexual abuse situation. Yeah, that's a big T trauma. But a parent that is emotionally
Right.
unavailable over and over and over and over might seem like a little thing because it's a little interactions that happen every day. But at the end of the day, that's
Correct.
the adult that is going to come to your office and it's going to be having no tools to be a parent themselves or to have very complicated.
Right.
Right.
The
So,
blueprint has
tho-
been
so
skewed.
those are traumas too. So that's why we have to be careful how we use the
Yeah.
word, but it's also important to know, and I say this in the book, and that's how I explain that trauma is a subjective definition, a subjective concept. Why? Because what is traumatic for me might not be traumatic for
Mhm.
you. So who am I to say that you're living a trauma or not living a trauma? I can tell you, the mother that had traumatized me. Okay, but when you see it from the outside, you're like, what's wrong with you? You had everything, everything's wonderful, it's beautiful,
Mhm.
she's caring, she's doing, you had food, you had shelter, you went to school every day. True, but there's other stuff that I experienced, and in my experience, that was very traumatic. Let's say I'm giving that as an example. Let's say so when somebody comes to you and says, "Well, my divorce was traumatic, or moving houses was traumatic for me." Okay, let's see where is that coming from. Let's see how come you're feeling it traumatic.
That's right. And so, guys, the reason
Thank
this
you.
book, and I'm just holding it up for everyone coming in, and um, the reason the book is important is that um, the intersectionalities of trauma are multifaceted and multi-layered. I ironically find if I don't think about it too hard, it all makes sense. Okay? So if you try and think about it too hard, your brain will start to spin. But if you grew up and you go through each of the attachment styles, which is also a little buzzy in some of the therapeutic coaching world, right? But if you grow up well reinforced, well attached with adults who show up loving, warm, boundary, like healthy, right? This is why you see some people go through things you cannot imagine. And and not just survive but thrive, right? They have the unexpected gift of trauma. They make meaning of their lives in a new way. Whereas you take someone who um, seems to have a trauma that you would say, okay, yeah, it was a rough breakup, right? If they weren't fortified from early childhood or those early years, things that seemingly, again, subjective, knock them down, break them, or break their beliefs in ways that sometimes I think people can be callous about or do comparative trauma. Well, you don't know because, right? Like, that's not trauma. Real trauma is, right? So I think so many people had so many different experiences, parents especially through the pandemic, that I don't even think, doctor, and what do you think of this? I mean, we're not even in a place where we can look at it yet. I think we're all still in it and we're all still
You definitely, I
comparing
mean, you're talking
trauma.
about the pandemic specifically? Yes, yes. I mean,
Yes.
yes, I'm gonna tell you something about that. First of all, this book, thank you so much for showing it. And part of what it's so important for me to, yes, to have it out there is because it brings so much hope for people that are going through difficulty. And the pandemic is one of the examples of like people going through difficulty because it says, yes, you're going through something difficult, but there's a light at the end of the tunnel. There's hope. Yes, you had parents that were not the ideal parents, but yes, you can transform that into something amazing. Oh, yes, something happened to you in childhood, or you're being a parent that is not the best parent. You can help your child shift that around and turn the breakdown into a breakthrough. But so that's why this book, I think one of the reasons why this book is so important that it gets out there. The other thing is that the book is not about trauma, it's about what happens after trauma. It's the growth that can happen after trauma, is the transformation that can happen after trauma, is that springboard that you can say. And there are 5 stages that we're gonna talk about. But in the pandemic,
Yeah.
we enter the stage of, yes, we're traumatized. And then the first stage is radical acceptance, which is I have to radically accept and be completely honest that I'm traumatized, or that this is happening to me, that I'm an addict, or I mean, I have an addictive behavior, or that I have been sexually abused, or that, the pandemic has affected me in ways that I can't even imagine, and I'm depressed or I'm anxious, or that first stage of like really recognizing and putting a name to what's happening and really saying, yes, this is happening to me. I no longer want to avoid or pretend it's happening, or look at my Netflix series every night, like to pretend that we're not in COVID and we're not in pandemic. So I think we're in that first stage. And then the second stage, it's the stage of awakening, which is like the safety and protect, reaching out for safety and protection. It's like, how do I get help knowing that that I'm traumatized? And that's why you see, and I'm sure you have it in your with the parents that you work with, that everybody's reaching out for help. Right?
I,
So, so
yes.
right.
Secondary
So it's
trauma
like
is
that.
real,
So it's
friend.
that second stage of this process in which, like, we're looking for therapy, we're looking for alternative ways of looking at things, we're looking for how do we express how we feel, how do we reach out, how do we find a safe and protected space, containment to talk about what happened to us. And then, so I think we are in that second stage, in relation to the pandemic. And then the third stage is the stage of new narratives, the stage of becoming, which is like, yes, your beliefs no longer work. Like we used to, let's say before the pandemic, we used to think that the world is safe, that the medical system works, that the government, is going to take care of us when if something like that were to happen immediately, that the world, the whole globe cannot stop, but then
Sorry.
so
Go ahead.
cute.
Sorry.
They like the topic. And then they then we realize, oh wow, those beliefs don't apply, and that goes for the children also. They say, oh, I'm at home and my parents don't know what's happening, and we don't know what's happening, right? So it's not like my parents have all the answers. I mean, right? Like we're all at home, or we're all dealing with the COVID or with trauma, and we don't know how to handle it. It's not like the adults know or the children don't. So when all those beliefs are broken, this third stage is like, okay, let's find new beliefs. Let's look at what's really out there that is more flexible, that is more open, that can help us explain what's happening. And this is where you see people reading more books, going out on retreats, finding new practices like yoga and meditation, and like new philosophies or new ways of thinking about the world, about ourselves. And it's
Joining communities, which you talk a lot about. Okay, and then
no,
go to the
right. No,
last
I'm just
step
saying. So
since you're
I
on the roll.
think we are between the second and third stage. Now, specifically about the
Mm-hmm.
pandemic, like that's where we are. Once we get to a more,
Mm-hmm.
once we evolve and get more of an understanding of this new narrative or these new perspectives that we have in life, and where we can really make that shift into like trying new things and owning them, comes the fourth stage, which is a stage of integration. So we're able to integrate this into everyday functioning. So as parents, as a family, we're no longer repeating what we used to do. It's like the old ways of being, but we're really integrating, especially now, for example, technology has developed so much. I mean, the pandemic, I think, has even pushed that further. So right?
Oh,
So how do
leaps.
we integrate that into our
Yep.
parenting style? Right? How do we create new ways of setting limits with our children in ways that make sense for us parents and for the children too? But not repeating what we used to know, because that doesn't work anymore. It's obsolete. It's like we see that it's not working. It creates more trauma. So now that we've integrated new ways, we can actually hold onto those new narratives and acknowledge what has happened to us in the past. So, for example, somebody that has been uh, sexually abused, and they come to give an example, or has gone through a divorce, or that has gone, they say, okay, I'm a new person, I'm changed, but I can acknowledge who I used to be. I also acknowledge that this happened to me in the past, So I can integrate all. And then the fifth stage, which is my favorite, and of course, this is where I want all of us to be, is the stage of wisdom and growth, which is the stage of like,
Yes.
okay, I can understand the priorities in my life and have a more meaningful way of relating to people in my life. My purpose is more clear, like I have a life purpose because I've gone through all this process of growth.
And this is the stage, I'm going to interrupt you, that is not often discussed, right? So you say often, and guys, this is why the book is important because of the hope, is that usually the goal with trauma is to bring you back, is to restore you. This is saying, no, we're not going to just bring you back. You actually use the word soar past, that you are not just
You're
going to
bouncing
bounce back,
forward.
or that's right. You are moving forward, which in that way is even more. It's even more than you were before, and even more hopeful. Not that we wish or we're glad the trauma happened, not that we'd go back and be like, yeah, you know what, let me lose a child, or let me watch my beloved grandmother die on tubes on a screen, right? Which
I
happened to
know.
so
I know.
many people. um so that hope, I have to give you an example, right, of how I kind of see this in my own life right now. So my own daughter was caught in a school
Wow.
shooting this time last
Can,
year,
can you can you can
about
you
over a
say
year
which
ago,
one or
and
no?
she's fine.
Which one?
Yeah, so it was at Edmund Burke in Washington DC, right? And he shot into the school from another building, right? And she ran outside. They had the drills, but they ran into the shooter. They didn't know he was outside. And so she was kind of behind a truck, and then they were running, and she was with her best friends and her teachers, and they got
Wow,
safe,
wow,
but the
wow,
whole
wow.
day, right? And and I was in Florida. And so my panic at not being able to reach my daughter, right? Like, I think just kind of like did me in for a while, right?
Hmm.
And it changed me two ways, right? Thank God everybody was already in therapy when it happened, right? My husband's the only one not in therapy, so we'll ask him what's wrong with him, right? I'm like, so the two things happened really. Number one, the first, I let go all of this kind of screaming loud activism and got very quiet and purposeful, right? I just took myself off the hook, right? And now I'm going to like work with the Brady group around ending gunfire in homes. I'm being
Yes.
so crystal clear, whereas before the shooting,
Right.
it was all over the place. Something
Right.
happens,
Right.
do this, do this, do this, right? Now it's just like,
Wow.
oh,
Wow.
this is what I'm doing, right? And then the second thing happened, which is my middle daughter switched. Everybody's been in different
Right.
schools in my house because of the pandemic. And she switched. She went from one school to another. And then she came to my husband and I, and she's a wonderful artist. I want to go back to my old school. I want to abandon this art school, very prestigious. And something happened where I said, life is very short. You are recognizing your mental health is most important.
Hmm.
Of course you can go
Wow.
back. Of course. I'm not afraid. I'm not afraid of you moving schools again. I would have been filled with fear. And don't get me wrong, I was still like, oh God, right?
Hmm.
But I would have been
Right.
filled with like,
Right.
oh, what
Right.
ifs and da 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 da. And what can we do?
Right.
And I would have made a thing. And this time I just said, you have wonderful arguments. I respect your decision. It's absolutely right, which is uh, shocking for me, but a gift to me, and especially to my
Wow.
child, to trust her voice. So rather than carrying my trauma forward in more fear, more what ifs, more like the world is an unsafe place. Da, 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 da. I said, I think life has taught us that you got to go
I'm
after
so
what you
impressed. I'm
want.
so impressed. And this is such a beautiful example. Thank you for sharing that because this doesn't just happen automatically. I think, thank you for mentioning that either through therapy or through friends or through talking about it and processing it, right? What was the most helpful
Yes,
to you to make those
yes.
transitions? Hmm,
Therapy, a somatic
perfect.
therapist. So for everyone out there who is very bright and verbal, I have talked my older therapists
Perfect.
in and out of my realities. I have skirted around,
Mhm.
told them what they wanted to
Exactly.
hear, put a red flag over there. And I'm sure a lot of you and you as a therapist have seen your clients do this, right? This therapist, I had to go into my body and experience the
E-
sensations in a safe
Exactly.
container and process so that when my body feels it, my throat closes for me, my right, that I can say, we're okay. What's the next choice, right? And I think what's beautiful about your book and for my work is that, yes, parents, you don't have to be perfect. You don't have to have all your trauma fixed. You don't have to do, you don't, it's like kind of like practice and then you die. Like, it's not like you made it. It's just keep waking up and repeating. Okay, right? Which I find very freeing. Just like, but you can be a container for a child. You can be that, right? So back to what you asked me, it was therapy and movement and lots of crying and lots of getting very
I love that. I mean, that's
focused.
such a perfect way of dealing with it and such a perfect example for other people because you see how, recognizing that this was traumatic, going for help, finding that safe container. That's the second stage. Third stage, reorganizing your thoughts and you're saying, how do I do this different? I can no longer be the parent that I was before, in which I was going to freak out or I'm going to, be nervous or afraid. I have to do something. And then you reach this place of like, you know what? I'm so clear about my priorities. I'm so clear about how to be a parent, at least in some circumstances. And of course, this is a cycle, right? So we get there and then we start back from the beginning and we get there. So that's okay. But those transformations are so beautiful. And then because you are doing that, your children are benefiting from those transformations as well. So that growth and that consciousness that you've acquired, you are also passing it on to your children and saying, yes, you can go and change. And I'm an example for you that you don't do this in fear and you don't do this without respecting your own voice and without really acknowledging who you are and what your purpose is, and do this with an intention. And I think that's what's so beautiful, that out of that very difficult trauma, like the relationships become more meaningful, like more intimate, more significant, the conversations, it's like I can talk to you in a way that it's so much more empathic and so much more compassionate because life is short, because we went through something
Yes.
difficult, because it shakes you in ways that you're like, I know what my values are, I know where I'm going. It really, I mean, it's painful, it's difficult, but people keep telling me I'm so grateful for what happened to me because it made me the person that I am today, and I don't want to give that up for anything in the world.
Yes. And I think, what you mention over in the book, which for everybody on and for most of my audience really watches this afterward, but that it requires concerted effort and courage. Can you talk a little bit more about, like, it's really
Right.
not just gonna happen, although meet people that have done it without maybe the stereotypical like Western therapy route, right? But can you talk more about the kind of
So
decision you
listen,
have to
when
make?
something traumatic happens, let's say a school shooting, people usually have the option, and usually what we all do is we develop trauma responses. And as you, I'm sure you know very well, and the people that listen to us, is that usually is fight, flight, or freeze. And this, we all do that because our survival, right? Our survival mode is
That's right.
like, let me fight, which is not just physically fighting, but I'm going to be irritable. I'm in a bad mood. I don't like anything. I can't relate to people. I push people away. It's like you get into this fighting. Your nervous system is like in constant, like, not feeling, relaxed or at peace. It's like, I'm on the edge. And it's a way of defending against the pain. Another response is, let me flee. Like I'm going to fight. I'm going to fly. Like I'm going to run away. And it's not like only physically running away. Some people, for example, there's a school shooting. Oh, I'm moving to another country. I'm moving to another state. I'm no longer talking to people. But that's a trauma response. I'm not saying not to do it. They're very, very important. Yes, it's
But
very
it is, though.
important to have those
That's right.
survival responses. Very important. But it also means like, I'm going to disconnect from my feeling. I'm going to run away from how I feel, for what I think, for what happens to me. I'm going to develop addictive behaviors that are going to keep me escaping. I'm going to watch TV all day. I'm going to be in my social media all day long. I'm going to pretend nothing. I'm going to dissociate from my feelings. I'm not going to not talk about what happened with my family. Let's pretend it never happened, right? These are all trauma responses. The third trauma response is the freeze. I'm completely paralyzed with this, which is what happened a lot during the pandemic. I can't make decisions. I don't know where to go. I don't know what to do. I don't feel anything. I'm in shock, in a state of like shock and paralysis, that there's nothing that can happen around that it's helping me make any kind of decision. And that's where I want to stay, because, that's my way of defending. So these are all natural responses to survive. So why do I say it takes courage? Because once we develop these trauma responses, it's very easy in some ways to stay in those responses, to keep escaping, right? And that's what the body
But it
knows, to
knows.
keep doing
That's
this
right.
addictive behavior, to keep running away, to keep being in a fighting mode, it's like this comfort zone that we're like defending. It takes so much courage, like what you did, to say, stop. Let me take a pause and say, what's really happening to me? There's something that's happening that I'm not doing well. And that usually happens when people reach rock bottom, when people go in such dark places that no longer, whatever you're doing no longer works, because you keep destroying things in your life, your relationships and your job and everything you're doing. So it's like, okay, let me stop, take a really good look at it, and almost like look at the monster in the face and say, okay, I acknowledge that this is happening. That takes so much courage, for you to say,
Yeah.
I know I've been traumatized. This school shooting really shook me. Thank God we're in therapy. Let's work through this. Let me find the special therapy that is going to help me. It doesn't have to be therapy. Some people are like, okay, I'm going to take some time off and go on a pilgrimage, or I'm going to start yoga. I'm going to find a community. I'm going to do psychedelics. Really. I mean, I give like a whole list of options there.
Yeah. Exercise, like it's what moves. There needs to be the movement out of
Exactly.
the stuckness.
Right.
Right? There needs the movement, the support, the community. And you write that it's important, the same community that opens you up can keep you stuck. The levels that you grow also require your courage, because you may find that, like, it took me courage to say, I'm not going to go and stand in the streets and scream about this gun stuff. I look like the person who should, but that's not my path, right? That takes courage, because my interior monologue is like, you're the perfect person. You need to. But my voice was like, that's not my lane.
Telling your daughter it's okay to switch from this prestigious school in which supposedly this is the right thing to do, but no, you're gonna follow your intuition and what you feel is right from the inside. It takes courage because of the pressure that is outside, because of what things are the way they are. It's very hard to switch things around, to change, you know?
Yeah. And I love that this book, everybody, acknowledges the rock bottomness of it, the spiral nature of it, right? That you keep
Right.
bumping into stuff, right? The intersectionalities of our cultural problems, political problems, racial inequities, communities that aren't safe. It's all
Right.
interwoven, right? And steps are the same. My last kind of thing that I think is important for the parents, at least in my audience, is that, and you acknowledge it in the book, is that resilience has become a big buzzword, right? And I hear a lot of justification in my work of really throwing kids into the deep end, and or even having them come out of the deep end. Well, they've built resilience, right? And I always ask, okay, at what cost? Right, but that's fine. And I don't ask that because empathy. I know what the parents are doing, and also our parenting culture keeps people Looney Tunes um, with the wind. But can you just discuss for the parents watching the difference between resilience after trauma and the growth,
Yes,
the actual
thank you.
growth?
Yeah. And I love that you're mentioning this collective trauma, because a school shooting is not just your trauma, but it was the trauma of the whole community. And sometimes that acknowledgement is not even there. So it makes you even more isolated in your experience from a cultural, community, social perspective. So I mean, that's why I made sure in my book to really, this is my way of thinking, also systemic. I'm very systemic in my thinking. And I cannot talk about, yes, I cannot talk
The book,
about an individual without talking about the system and how it affects every relationship. So I appreciate how you're saying, like, this is what happened to me, but it's also affecting everything around me. It's a community situation. And not everybody has to do the same, but there has to be an acknowledgement that this is this has a wide range of effects and consequences. And having said that, talking about resilience, yes, resilience, everybody, you know, that's a fun word. Everybody uses nothing against resilience,
tough,
nothing. I
yeah,
mean, I
yeah.
love it. It's all good. But what I'm saying is that resilience is a way of bouncing back. That's really the definition of resilience. It's like people have the tools and the resources to face and overcome difficult situations, and it's great. It's wonderful that children can have that. Some children are born with more resilience than others. That's wonderful. What I'm saying is that when you have that, there's no chance of usually of developing post-traumatic growth. Why? Because for post-traumatic growth to happen, something usually takes you to a very difficult and painful place in which you have to really open up to something new. When you're resilient, there's a lot of defenses that are there that are working fine. But what I'm asking is to say, let go of those defenses, obviously in a very contained and protected and secure place. But those defenses are the ones that are preventing you from really growing and from reaching this post-traumatic growth stage. And post-traumatic growth, like we said before, is bouncing forward, is transforming, is changing, is not going back to who you are. It's really, you become something else. And the perfect example for that also is the butterfly. When you're, and I was looking at that really from a scientific perspective, when the worm, you know, is like in that cocoon, uh that worm no longer, this gets destroyed inside, because they're like these juices that actually destroy the body of the worm in order to reconfigure that in a completely different being, you know, or insect that becomes then that butterfly. If you interrupt that process, the butterfly doesn't get formed and doesn't is not born. If you help that worm, to do, that it doesn't either. So there's something that needs to happen in that moment that really shifts things around for that butterfly to become so beautiful and be, strong and flying and with so many colors and so many things, that it's within like a very delicate, courageous, and long process. It really takes a while. Yeah. Yeah, and messy,
Mess.
very messy. Yes.
And I love that. And when I read about that in the book, it's so important for humans to remember that that is not a metaphor. We are part of the natural world.
Exactly.
We are mammals. We, just because we have this prefrontal cortex that gives us garbage all day long, right, does not mean that we are different from the caterpillar. It is not like the mess and the soup. We can dress it up and put lipstick on it, literally,
Right.
but like it is the mess we are in. And so I want parents watching to become keen to the shake off of the resilience. He's back to blank. They're doing blank.
Right.
Yes.
So that
And
messiness, that making mistakes, that moment of like, yes, you make the container, but you allow the messiness to happen inside, because that's where these things get formed, take shape. This is where the kids start finding their own voices, their own courage, their own shapes. And I think that's I think fundamental for parenting, right? It's like, how do you facilitate without intervening? How do you facilitate, right, that containment?
it's an
Right.
ultimate courageous act. And especially for so many of us who
Yes.
never got that in childhood. So we creating our own
Yeah.
containers for our own mess as we try to. So really, one of the important steps, especially for parents watching this later, is to read the book. It's hopeful. It's really hopeful, and we need hope. And take to heart the different steps that are maybe missing for you. I find personally it's the support and community and the like-mindedness, right? A lot of us
Mm.
didn't grow up with reaching out, but for other people watching, it may be
Yeah.
willing
Yeah.
to have radical acceptance. It may be willing to say, these beliefs aren't working. I need a new faith system,
Right.
spirituality, whatever. But it's really important. So I
Thank
don't
you.
want to hold you too much longer. Is there any, and also in the book, guys, Dr. Shiro has done so much boots on the ground work and seen this to fruition. So these aren't just ideas. This is what has happened in some of the people she knows and within communities that have really sustained
Yeah.
incredible
And it's
amounts
and
of
it's been
trauma.
beautiful to see those transformations. And thank you for saying that, because it's not just a theory. I mean, I see it in my office every day, but I also see it in communities. And yes, the last thing I do want to say is to emphasize that trauma is relational, but healing is relational also, which means that we heal in relationships, we heal in community, we heal as parents being present for our children, because the trauma that our children go through is not what happens to them, it's not the bullying itself, it's not the shooting, it's the lack of presence to be able to express it, to talk about it, to be contained, to be accompanied in that experience. That's what I think we need to keep in mind as
That's
parents, is to say we cannot protect our children from everything that is going to happen to them, unfortunately, because isn't that what we all, what more do we want, right? For our children not to suffer. Of course, there's a part of us as parents that we don't want our children to suffer. It's a natural reaction. But on the other hand, it's like, when it does happen, because it will happen throughout their lives, is how you are present in their lives to facilitate that conversation, to facilitate that process for them. And that happens in the relationship with them. And that's why I'm saying, yes, the trauma is relational, but the healing is relational also. And not just from parents to children,
Mm.
but for the community, for the school, for the family, for the extended family, for the society. That's why these kind of conversations are so important, because it's not just you or just me that are dealing with this. It's like we're part of a society that when we open up for dialogue, is that we create more consciousness so other people can be present too for our children and for everybody else, you know. So I think if we
Yeah.
keep that in mind, this is where we go to a more conscious society, to a more peaceful society in which, please, I hope at some point we get to no violence and no shootings and no, right, in which we can all can be acknowledged and validated, in which, you know, children can feel recognized and belonging, so they so these kind of things don't happen.
Yeah.
Yes, amen to that. Yes.
Amen. Amen. Um, well, thank you so
Thank you.
much. It's a beautiful book. It's a beautiful cover. It's much needed. I recommend it to everyone. It's not just a book for therapists or coaches, or it's for anyone who is alive and has a nervous
Exactly.
system. If you are alive, the world is a wounding place. It's also a beautiful place, and you can change your wounds and pain and despair, not just into, okay, fine, I'll live with it, but live
Yes.
more
And
beautifully.
thank you so much for
Yeah,
all this support. And please let me know if some questions, more questions come up. I would love to open up for conversation, and maybe we'll meet again and then we discuss some of the questions that have come up. And that will be,
I love that. I will love that. Maybe I'll put it out to my community. I know you're very busy, so we don't want to take your time, but it's we'll put it out and maybe have a
thank
really
you.
lively discussion and
Thank you.
help
Thank you
some
for the
people.
work that
That
you
would be
do
great.
also, and for being such a good guide and, you know, example for other parents out there. So thank you so much.
Thank, thank
You too.
Beautiful day. And
Yes.
everybody go grab the book and shout her
Yes.
out, follow her on
Yes.
Instagram and all the places, and let her know
Thank
what
you.
the work means to you.
Bye.
Thanks, everybody.
Be in touch.
Bye.
Bye.